It's with great pleasure that I welcome my friend Dr. Ajit Sachdeva, the Director of the Division of Education at the American College of Surgeons. Good morning, Sach.
Good morning, Steve. It's great to join Dr. Wexner for the session. Thank you.
Well, appreciate it. I've enjoyed working with you very much these last 8 years as a regent and years before that occasion, and very appreciative of all you do to educate all of us surgeons around the world. As amazing as you are at initiating and executing on educational activities, I think you had a real challenge this year in being able to convert an in-person annual clinical congress to a virtual one. So I'd like to start our interview asking you to tell us a little bit about what to expect in October.
This year, unlike ever before, we are going to have a virtual meeting, and it will actually be a two-part meeting. There's a virtual component, and then there will be an asynchronous component offered online. We had approved the program for the 2020 Clinical Congress last year, as we always do, the year prior to the meeting. And that included the entire lineup of 11 name lectures, 122 panels, about 14 postgraduate courses of a didactic nature, 15 skills courses, etc. And given the fact that we've had to move to a virtual platform, we have changed that program and the layout considerably. We will accommodate all the name lectures. There is one speaker who cannot do this, so we will have 10 name lectures, and we are using those as anchors throughout the program. And the program itself is going to be 3 days long instead of the slightly longer meeting that we have in person each year. So we will have the program run from 9 in the morning Central Time to 4 in the afternoon Central Time, with a 1 hour slot in the middle of the day that will be devoted to special sessions and the symposium of the ACS Academy of Master Surgeon Educators on Monday. So this program will be composed of 3 1-hour blocks in the morning and 3 in the afternoon. And as I mentioned before, we will have our 10 name lectures distributed across the 3 days, and they will really be the anchors of the themes. So, for example, if there is a name lecture on ethics, the Connolly lecture, the 2 1-hour slots after that, the panels will be focused on the ethics topic, and so on and so forth. So when you look at the various topics, that's the way it's going to get laid out. On the first day of the program, we will have the opening session from 8 to 9 Central Time prior to the 9 o'clock opening slot. And that will include a lot of the pomp and circumstance of our usual opening session and the Martin Memorial Lecture as well. Beyond that, we have had to cut back on the number of panels we can accommodate, and there will be about 60 some panels offered during the 3 days. The remainder will be offered in the asynchronous track, and I'll come back to when that will be actually physically available. Now, in terms of the rest of the program, we will also have several other sessions like the forum sessions, the video-based education sessions, and the Meet the Expert sessions. We have moved the Meet the Expert sessions to the end of the day rather than the beginning or the middle of the day, because we thought an interactive small group dialogue towards the end of the day might be a little bit better, given the fact that people are tired at the end of the day, and we didn't want to stick a panel or a lecture at that point. There will be a total of 12 slots allocated to the forum sessions and the video-based education sessions. The remainder of the forum sessions, again, will be offered asynchronously, and the video-based education sessions we are envisioning, the ones that were selected and cannot be presented during the 3 days, will be automatically put into our video library as sessions that were selected for the 2020 program, but what were not actually presented, but they will go into a Cinemed video library. Beyond that, the town halls will not be held because we didn't think we should take a 1 hour slot in the morning for the town halls. And the courses, the skills courses, we are not going to hold this year at all. We may offer some regional courses at our ACS accredited education institutes, but the bulk of those skills courses will be carried over into 2021 with 6 new proposals that are being considered right now as we speak. So there will be a slight change in the lineup of skills courses from what was envisioned for 2020, but a lot of them will be just carried over from 2020 to 2021. The didactic courses, we plan to offer them asynchronously in the track that will start after the Congress. So that's the general layout of the program during the 3 days, Monday, Tuesday, Wednesday, of the originally scheduled clinical Congress. The convocation, which is being coordinated by member services under Dr. Turner's watch and by executive services under the direction of Dr. Hoyt, that will be held on Sunday evening and will be a wonderful event. There will be an ACS Central type activity throughout the 3 days of the meeting, again, being coordinated by member services, and that would allow members of the college to interact informally, ask questions, get guidance, etc. So that will happen during the 3 days. We are not planning to have any lectures in the, in quotes, theater of the ACS Central that used to occur physically in the past. We will pick that up again next year. And we have cut out a fair number of the social events, including the Taste of the City on Wednesday evening. That will not be held. On Monday evening, there will be an opportunity for various departments to have receptions, virtual receptions, if they would like to do that. And also there will be an opportunity for technical exhibitors to present the scientific posters or the scientific exhibits. Those will be available online as e-posters, as has been done in the past year. So that is the overall plan for the 3 days. After the meeting ends on Wednesday, we will turn over the recorded sessions from the 3 days and make them available for another 7 weeks through the end of November after Thanksgiving for people to access. At the end of November, this part will come to a close, and December 1, we plan to launch the asynchronous portion, which would include these 3 days program, plus the sessions that were not presented along the lines that I mentioned, especially the panels and the forum sessions, and those will be available as webcasts through our learning and content management system through the Clinical Congress of 2021. As we've done in the past, we've offered webcasts. A couple of other things. We have a very reduced fee that we've decided on for members. Non-members have a slightly higher fee, but it's still negligible given the program, and that fee will cover the 3 days of the program plus the 7 weeks after that of the program's availability online. The webcasts that start December 1 will have their own fee structure as they've had before in previous years. Also, medical students and residents will have no fee. We are planning to offer the Congress to them at no cost. And also, I should mention there will be a 3-hour program on Monday afternoon for the residents, an abbreviated program compared to previous years. And likewise, a 3-hour program on Tuesday afternoon for the medical students. Again, a very abbreviated program, but that is going to be carried over longitudinally through the year so that it's a long program of which these 3 hours are just one component. I'll finally mention one other thing, unless you have other questions about the Congress, and that is for the moderators and the presenters. We are in the final stages of blueprinting the 3 days. We are hoping to have that ready by the end of the day today. And messages and letters will go out to the moderators explaining to them the new format and the fact that they have to cut down their panels from 1.5 hours, which has been the traditional length, to 1 hour. So they'll have to make the adjustments in the speakers, topics, etc., that they would like to cover. Also, they will be asked to have the speakers pre-recorded, and that should be fairly simple. We've all been involved with pre-recording our sessions and our presentations using PowerPoint or any such program. So we will get all the information out, and people can record their presentations at home. We will ask them to send us those presentations by the end of August. So we have a full month to work with the vendor to put it on the platform, to troubleshoot, to make sure everything is in order. Now, the presentations will be recorded, as I mentioned, and played back, but it will be a live interactive session. So we are going to be asking the speakers to be available for the introduction of each one of the sessions and for the Q&A. And all that will be recorded and will be part of the online availability of these sessions after the 3 days are done. So that is the overall plan for the Congress as we see it right now. And it's been a major adjustment, but we have a great vendor identified through the discussions we've had internally at the leadership level of the college. And I think it's going to be a great event, and we are really looking forward to it.
Thanks very much, Dr. Sachdeva. And it certainly sounds like it's going to be a sensational event with the ACS again setting the new benchmark standard for how virtual congresses should occur. One question about the panels: will people who register be able to go among rooms, as would normally be the case, that you walk into your one lecture in one room and then you go to a different part of the convention center because you'd like to hear a different lecture? That's one question. And the second one, in terms of asking questions of the speakers, will the chat function be used on a Zoom type platform, or is there some other way for people to ask questions?
Great questions, Dr. Wexner. The first item is people moving from one session to the other. We are envisioning that we will have a program book with all the sessions listed, and we will also most likely have an app like we've had in previous years. We haven't quite decided on the details. So if you were interested in attending a panel at one point on one of the channels, you could click onto that topic. You'll be taken to that room. And then after that, if you want to switch to another room, again, you select what you want to join, and you'll be automatically taken to that room. There will be 5 parallel channels, as we're calling them, going on. So you could stay within one channel, jump around, and other than the channel for the forum and the video-based education sessions, the abstract-driven sessions, there isn't really a dedicated channel for certain topics. So they will be mixed across channels, so people will have the opportunity from one to the other. And of course, as they go from one to the other and register for the new session, they'll automatically be logged into our CME system, so the CME credits can be provided for that participation. Now, in regard to the questions, yes, we are going to be using a Zoom type platform, so there will be an opportunity for people to use the chat function of Zoom. But in addition to that, as you will recall, we've always had two moderators for each one of our panels, co-moderators. We are going to be asking one of those people to be the person monitoring the chat room and any other items that come up. And people can also ask live questions from the audience. We will have that ability as well, but the chat function will be available, and the co-moderator would be a great help. And of course, we'll have other technical people assisting as well.
Well, thanks for that wealth of information, and congratulations on very rapidly transforming the world's premier annual clinical congress for surgeons into a virtual platform that we can all enjoy and benefit from the educational content, not only during the initial Monday, Tuesday, and Wednesday, but subsequently for a long time thereafter. I'm certainly looking forward to it. I wish I was going to get to see you in person in October, but hopefully eventually all this problem will be behind us, and we will get back together for an in-person meeting. In the meantime, I wish you sustained health and success with the Congress.
Thank you. And I too look forward to seeing you, hopefully sooner than later. And we are hoping that the pandemic is behind us soon so we can move forward. Thanks.
Thanks.